9:13 now, 55 degrees on the boulevard. And we mentioned it earlier in the 8 o'clock hour, now at 9 o'clock. We welcome in our guest as it's the final day, Michelle, you mentioned, of Mental Health Awareness Month.
Yes, and I noticed she's wearing green, representing the color for mental health awareness. We've got licensed clinical counselor from the Cleveland Clinic Behavioral Health Center, just right across the street from us, Patricia Miller. And good morning.
Good morning.
Thank you so much for being here this morning. I love your green.
Thank you.
And you're representing. I love that. We learned that quick early on this month that green was the color for the month. So have you been wearing green every day?
No.
It gets tiresome, I'm sure.
Yeah, the wardrobe runs out.
I don't have enough for 30 days.
Right, exactly. All right, we're going to get right into it. Tell us a little bit about yourself and the Behavioral Health Center across the street.
Okay, I'm a licensed professional clinical counselor with a supervisory designation, and I'm also a licensed social worker. I have 35 years of experience working with ages as young as 5, all through up into older adulthood. Over the years, I've worked with individuals, couples, families, and in a group setting. Currently, I work over at the Behavioral Health Center, which is on the ground floor of the 300 building on Medical Park Drive, just right behind the hospital. The Behavioral Health Center provides intensive outpatient treatment, and we call that IOP for short. This is not inpatient treatment. It's outpatient treatment, but at a more intensive level. So with traditional outpatient treatment, a patient would see their counselor for maybe 50 minutes every 1 to 2 weeks, if they can get them in that often. With IOP, the patient attends treatment 3 days a week, 3 hours a day. Sometimes when someone is seeing an individual outpatient therapist, they might feel better for a few days or a week after their session, but they might find that they can't sustain that progress, or traditional outpatient might not quite be enough to best manage the symptoms that they're experiencing, and that's where BHC can come in.
So, Patty, we've been talking all month with all of our area organizations and practitioners, and I mean, the need has been described by them. But of course, I'll ask you, especially with something so intensive and so effective, can you describe the need for outpatient mental health care right here in Tuscarawas County?
Absolutely. So what we do know is that 1 in 5 people have some kind of mental or emotional struggle of some nature sometime in their life that prevents them from really living that life in a fulfilling manner. Struggles like anxiety, depression, or both of them together can negatively affect many areas of a person's life, such as family life, intimate relationships, just coping with everyday stressors, and maybe in one's job. Our patients come from many different walks of life. We have been honored to work with a variety of people: nurses, teachers, lawyers, other professionals, as well as blue-collar workers from all over the county and beyond. The privacy of our patients, though I want to emphasize, is of the utmost importance to us. We are certain to protect that privacy, the fact that they're even coming to treatment, and their identities. And I think one of the ways that we do that is because of our location. We are not in the hospital itself. We are outside the hospital in an office that has doctor's offices. So when a person's coming in, it's not necessarily made known what they're coming into that building for. So there is a certain amount of privacy in that.
A little more private, which is nice. What kind of assistance and care do you guys offer for your patients?
So we provide individualized care, offering a combination of one-on-one therapy and group skills training. And it's with professionally trained therapists, as well as the opportunity for medication treatment if they should desire that, with our psychiatric providers and our program nurse manager. Together as a team, we address issues like depression, anxiety, panic disorder, obsessive compulsive disorder, and disorders involving quick up and down mood swings, and many others. The skills training program provides patients with multiple tools and coping skills that they can use to effectively manage the symptoms that they're having both daily, and they can do that now and in the future. So the skills work now, and then they have them in the future to work as well, which is, we're being told by our patients, and we see it every day. It's very empowering and very liberating. Especially if before they came in, they've been feeling victim to out-of-control emotions for some time.
So you begin this process. Somebody's finally walked in the door, and you're assessing them. How are you going about it after that? How are you taking care of all of these patients walking through the door?
Okay, so once we've met with them and we've determined that IOP can be beneficial to them, we do a number of assessments. Our program nurse manager, she will do a nursing assessment. What we call a psychosocial assessment will be completed by a therapist. And then our psychiatric provider will complete what's called a history and physical. And then as a team, we put all that together and we work as a team with the patient to work to create the individualized treatment plan that's going to be best for them. We develop a care plan that combines therapy and skills training. And if the patient is interested in medications, then that will also be included in their treatment plan. As the patient learns and practices and utilizes their new coping skills, they begin to succeed in managing their emotions little by little. And they have the ability to manage them when they felt very out of control in the past, which is a wonderful feeling. And before the patient completes their treatment journey with us, we set up follow-up care with outpatient therapists and providers who will continue prescribing medications, because when a patient has worked so hard to achieve the progress that they have, we don't want them to have to worry about waning in that progress. So we want to make sure that they have the proper care to follow up and continue in their journey.
And how have the patients been receiving that overall? Has it been successful for them?
Yes, we've seen a great deal of success. Our multidisciplinary approach allows us to develop comprehensive plans that best meet the needs of each patient. And we have looked into our rates. We've researched our success rates over the past few years. And we found that nearly all of our patients who have come through and completed our program report improvement in their mental and emotional well-being. And more exciting, 80% report in their opinion, significant decrease in symptoms after just the 4 to 6 weeks of treatment in IOP. Yes, the beauty is the group skills training. It's regardless of the source that a person comes in, with their struggles, regardless what the source of that emotional struggle is, the patients soon realize that they're all working together and supporting each other to the same end, which is to learn to manage emotions instead of those emotions running their lives. Plus, I also want to emphasize that if after we initially meet with somebody, we don't believe our program will be the best fit for them or meet their needs, we help to facilitate a referral to another type of treatment or other mental health providers in the community.
That's nice. So if you notice that you're not able to, fully help them succeed in their journey,
right,
you're willing to, well, maybe this would work better for you.
Right. And we don't charge for that first session either.
Oh, wow.
Yeah.
Oh,
so I want to make sure that the public understands that. Give us a call.
That's been such an ongoing theme throughout all these conversations, is agencies and organizations that are, it almost feels like they're connected. Everybody's always willing to refer, to help people find that source that is right for them. And so just that teamwork almost to treat the whole person and to continue that treatment just seems so important. And
it is.
Another important part that we talked about this month is that first step, which is after recognizing the issue, finding that solution. And this really does sound like the solution. How do we start that process, Patty?
Well, first of all, I want to emphasize one other point. All of us over at the Behavioral Health Center who work with patients daily, we're all from the Tuscarawas County area. So we were born and raised. We understand the specific needs of the community, the challenges of being in a rural community. We understand, that type of thing. So we are very much in tune. And it's important also to know that in order to access our services, a doctor's referral is absolutely not necessary. Patients can call us on their own. They can contact us, and we can usually schedule an assessment within 1 day. And then a few days later, their treatment begins.
I mean, that's amazing to me. Even primary care physicians can be weeks out. There's so many opportunities that you just have to schedule so far in advance to get that immediate. And I think when it comes to mental health, immediate is usually a necessary factor in that process.
Absolutely. And many patients come to us at the recommendation of their doctor. Like a lot of people go in and talk to their doctors about what they're struggling with. We also get referrals from individual outpatient therapists, just like you said, in the community. And now that we've been open over there for 8.5 years, we're also getting referrals by word of mouth. People are knowing other people who have come through the program, who have seen progress and maintained that progress. And so they're coming in as a referral just from people that they know. Our services are covered by most commercial insurances, and we also accept Medicare and Medicaid. And we just want to emphasize that if anyone at all is struggling emotionally or mentally, give us a call, 330-308-3700, and we'll be happy to assist them.
That's amazing. I feel like this is such an important topic just to keep, not just during Mental Health Awareness Month, something that it needs to be at the forefront of all of our minds. If you know somebody that's struggling, if you're struggling, don't hesitate to reach out. If you know somebody that is struggling, maybe try to help them, give you guys a call, and you guys will be able to assist them in any direction that they need to go.
That's correct. We can do that.
Amazing.
Yeah. Michele, and I think if we learned anything over this month, it's that no one needs to do this on their own in this community.
Right.
We're surrounded by people like Patricia Miller, who's able to get us the help we need. And I mean, within what was that time frame?
4 to 6 weeks.
4 to 6 weeks, just the significant improvement in how someone is doing, how their mental health is being rated is just, what an incredible turnaround.
Absolutely.
Right.
Well, again,
Well, thank you for what you do.
Thank you for having me here.
Oh, absolutely. It brings us to 9:25. 53 degrees out there on the boulevard. A few things more to bring your way in this 9 o'clock hour. We'll talk about it coming up on the Ryan and Michele Morning Show.